motivation, and discipline.
Okay.
And so what are the steps? I just demonstrated how to brush properly. That's one important thing. Brushing twice in a day. If you can do that morning and last thing at night before going to bed, using dental floss or another interdental cleaning aid. Ensuring you visit your dentist at least twice in a year or even once a year, or as often as the need arises. And also eating the right types of food.
What are these right types?
Thank you. Right types of food, by this I mean...
We have a call.
Okay.
Hello. Hello.
Hello. Good afternoon.
Good afternoon. Do ask your question.
My name is Alan. I'm calling from Abuja.
Alex.
Alan.
Alan. Please, Alan, go ahead with your question.
Okay. I want to confirm about teeth issue, especially something they call teeth skeleton and teeth bleaching. Is it advisable for someone to do a teeth bleaching? Does it have any side effect? That is my question.
Okay, thank you. Did you get that?
Yes, if I got him right, he asked about teeth bleaching.
Okay, whitening of teeth.
Whitening of the teeth.
Yes.
If it's indicated, then there's nothing wrong in it.
Oh, there are indications to whiten the teeth.
Yes.
Where the dentist actually tells you you need to get your teeth whitened.
Yes. Sometimes some people that have some discoloration that could be intrinsic or intrinsic, maybe from tetracycline stains, if it's not too severe, at times we recommend tooth bleaching.
But if there's no recommendation, you shouldn't bother.
No. At times, what people misinterpret as things that could cause discoloration could actually be from deposits, maybe plaque and calculus deposit on the teeth surfaces, and these are extrinsic causes of discoloration. So if it's plaque or calculus, then we would recommend and advise scaling and polishing rather than tooth bleaching. Okay. So he asked another question, does it have any side effects? Sometimes, because it's still acid, we're still using some acid, it could remove a layer of the tooth surface, and of course that could result maybe perhaps in some sensitivity, but that also can be managed by the dentist.
Okay. Now, how does age affect the oral cavity? Are there any rules for older people to take care of their teeth?
The rules are not different than for the younger people.
It's not like tissues loosen.
But they do actually. So as we get older, our bodies become weaker. For instance, even the blood vessels they lose their elasticity. And also part of the tooth structure there are some changes that take place. And because of that, there's reduced blood supply. So healing, for instance,
takes longer. I believe we have a caller on the line. Hello?
Hello.
Hello.
Hello, good afternoon.
What's your name and ask your question?
I'm Adedoyin from Ikorodu.
Adedoyin, please do ask your question.
Yeah, I want to find out. When I was young, I had a broken tooth, and it was eventually removed. But I discovered that I've been used to using denture. But what is other method or other things that we adopt apart from denture that be more secure?
Okay, I believe we've got the bulk of the question.
Yes.
He was using dentures.
Yes.
Okay, and he's asking if there's an alternative.
Yes, they're actually alternative. Denture is basically a removable form of artificial replacement of a missing tooth or teeth. However, there are other alternatives such as bridges, that is crown and bridges, or even more recently, implants, which are available even in the country. That is, the dentist will sink an implant, through a minor surgical procedure, and then that is a permanent thing.
Okay, so it's like a permanent tooth. It stays there. You don't have to take it off.
You don't have to take it off. So that's available. So there are options.
Now, how does one clean the teeth with braces on? Is it, some people have braces on for 6 months, 1 year, and they're just there. Is it possible to get those cleaned up too?
Yes, it is. They have to pay more attention. They have to clean more frequently. they have to actually use some of the interdental cleaning aids. I didn't bring some of them that
Okay.
are different. We have some brushes, for instance, that are single tufted brushes. That is the tip. It's just like it contains
Just a few bristles.
And then they also have some flossers that they use particularly above or below the braces.
Okay.
But the important thing is that they have to just brush more frequently after every meal, before every meal, and they are given such instruction by the orthodontist.
Okay.
Who are the specialists.
Now, let's assume somebody doesn't take care of his teeth so well, doesn't pay attention so much. What conditions could you have from faulty oral care?
Okay. The two that I believe are the two most common are dental caries, which is tooth decay.
Okay. That's when you start to have a hole burrowing in your tooth.
In the tooth. But that also has to do with the diet, like we were talking about before. People that take a lot of refined carbohydrates, sugars,
that's part of the bad diet.
Bad diet we're talking about. So that in itself could result in tooth decay. And when also they don't clean properly, so the plaque contains germs. But importantly, another one, the second one that is quite common is gum disease, periodontal disease, which is really my area. You know, it could be gingivitis, in form of gingivitis, which just means the gums are inflamed. You know, there is bleeding, you know, which is in fact, the earliest sign of gum disease, bleeding. Or it could progress even to periodontitis when the supporting tissues, that is the bone, the gum, they become weak, they become damaged.
All this because you're not brushing well.
Because one is not brushing well.
I'm sorry, doctor. It's been wonderful having you on the show. I have to, you know, I warned you about this. We have to close. Okay. Thank you so much for coming. Thank you so much. And thank you for being with us. It's been a pleasure having you with us. Let's do it again next time. I'm Mary Alale Yusuf.